Welcome, everyone, to vpod.ai. Today, we're doing a deep dive into gallbladder cancer. It's a topic that touches many lives, often quite quietly, actually. Our goal here is really to cut through some of the complexity, pull out the key insights so you can feel well informed. Now, before we get started, I just want to mention that this deep dive is sponsored by Stonefly. They're a trusted solution provider and advisor in areas like enterprise storage, backup disaster recovery, hyper-converged setups, VMware, Hyper-V Proxmox clusters, also AI servers, and their SA365 turnkey security appliance, plus public and private cloud solutions. You can find out a lot more about what they offer at stonefly.com. So today, we're going to explore how gallbladder cancer is typically found. We'll look at the staging process in detail, the kind of nuances of surgical management, and even touch on really crucial nutritional considerations during treatment. I think you might be surprised by some of the challenges, especially around early detection and how how they've evolved medically.
Indeed. And what's really fascinating, I think, is just how often this cancer is found almost by accident, incidentally. And that discovery, that chance finding, it really shapes the entire journey, right from diagnosis through treatment. It does raise a big question, though. How do we optimize care when those early signs are just so subtle, almost invisible sometimes?
That's such a critical point to start with.
Yeah.
Gallbladder cancer, it's notoriously tricky to catch early. I mean, the gallbladder itself is tucked away deep inside the body, right?
Sure.
So you're not going to see or feel tumors during a routine physical exam. And unfortunately, there aren't really reliable blood tests or other screening tools that can pick it up when it's small and hasn't spread, which means most of the time, these cancers are only found after they've grown large enough to cause symptoms, and that often points towards a more advanced stage already.
Precisely. And like you said, when those symptoms do show up, they can be quite vague. Things like, unexplained pain in the belly, maybe bloating, sometimes weight loss, jaundice, that yellowing of the skin and eyes, that's usually a sign it's more advanced. Maybe the tumor is blocking bile ducts. But here's the really interesting part. A significant chunk of the early stage cancers, they're found completely unexpectedly.
Yeah, and this isn't just like an interesting tidbit. It's really fundamental to understanding gallbladder cancer. Its earliest detection often isn't from symptoms, it's not from screening, but it's this sort of fortunate accident during surgery for something else, like gallstones, right? That seems to be the most common scenario. Someone goes in to have their gallbladder out because of gallstone pain, and then the pathologist, examining the removed gallbladder, finds a small cancer or maybe precancerous cells that weren't causing any trouble at all. And that incidental finding, it just completely changes everything for the patient from that point forward.
Absolutely. And once that diagnosis is made, maybe unexpectedly, the next step for doctors is figuring out exactly how much cancer there is and where it is. That whole process is called staging. It's meticulous, and it's crucial because it helps predict the patient's outlook, their prognosis, and it really guides the treatment decisions. The gallbladder wall itself has layers from the inside lining, the epithelium, out to the outer layer, the serosa. How deep the tumor has grown through those layers is a really key part of the staging.
Okay, so given this often unexpected discovery, how is the staging actually done? I know there's a standard system, PNM, is that right?
That's right, yeah. The most common system is the AJCC TNM system. It uses three key pieces of info. T stands for the primary tumor, basically, how far it's grown into the gallbladder wall and maybe into nearby organs like the liver. N is for lymph nodes, whether it's spread to nearby lymph nodes, and critically, how many nodes are involved. And M is for metastasis, has the cancer spread to distant parts of the body, like maybe the liver elsewhere, the lining of the abdomen, or the lungs.
And it's not just about T, N, and M, is it? I gather other factors also play a role in figuring out the likely outcome, the prognosis.
You're spot on. Beyond those TNM categories, other things definitely matter, like the cancer's grade, which is essentially how abnormal the cells look under a microscope. Low-grade cancers tend to grow slower. The specific subtype matters too. For instance, there's one called papillary adenocarcinoma, which often has a slightly better prognosis. It tends to grow in these sort of finger-like projections, less aggressively than the more common adenocarcinomas. And another thing doctors look for is lymphovascular invasion, if cancer cells are seen in tiny blood vessels or lymph channels. That's a sign it might have started to spread, which, can suggest a poorer outlook.
Okay, so since many are found incidentally, surgery must play a huge role. What does surgical management actually involve for gallbladder cancer?
Right, surgery is the only treatment that offers a potential cure. But For most gallbladder cancers, just removing the gallbladder, a simple cholecystectomy isn't enough. See, the side of the gallbladder next to the liver doesn't have that protective lining, the peritoneum, so tumors can quite easily invade the liver right next to it. And that's why a more extensive operation called a radical cholecystectomy is often what's needed.
Okay, radical cholecystectomy. So that sounds like more than just taking out the gallbladder. What else does it involve? Why radical?
Yeah, it means removing the gallbladder plus a margin of the nearby liver tissue. Typically specific segments, 4B and 5, which are right up against the gallbladder. That's because they're common spots for the cancer to spread into. The surgery also involves what's called a regional lymphadenectomy, clearing out the lymph nodes in that area. The goal is twofold. Get clear margins, meaning no cancer cells left at the edges, and also get really accurate staging info. Because, up to a third of patients, depending on the stage, might have tiny hidden metastases in that adjacent liver tissue.
It seems logical, maybe, to think more is better when you're trying to get rid of cancer. How did doctors figure out that wasn't always the best approach with these big surgeries? I heard there's been some shift in thinking about just how extensive they need to be.
That's a really important point, yeah. It reflects an evolution in medical thinking. There's definitely been a move away from doing very large liver resections or routinely taking out the bile duct unless it's clearly necessary because the cancer involves it. Some older approaches did favor these major liver surgeries, but the current expert thinking is more about tailoring the liver resection. Take enough to get those negative margins based on the tumor's specific stage and location, rather than just removing a large chunk empirically. One of the key insights, I think, is that it's not always about doing more surgery, but about doing smarter, more targeted surgery. Studies started showing these really big empiric resections didn't necessarily improve survival rates, but did significantly increase complications and even mortality.
So being strategic, not just aggressive, makes sense.
Hmm.
And what about removing the lymph nodes? Same principle. Is more always better there?
Well, the lymphadenectomy, removing those nodes, it's absolutely crucial for accurate staging. It tells us how far the cancer might have spread, which helps predict the outlook. That's its prognostic value. But just removing more and more lymph nodes beyond what's needed for that staging information doesn't necessarily improve the cure rate or help people live longer. That's the therapeutic advantage question. So its main job is really getting that crucial information to guide the next steps, like deciding if additional therapy, maybe chemotherapy, is needed after surgery. Getting at least 4 and ideally 6 or more of those regional lymph nodes is usually the target for good staging.
You mentioned other therapies like chemotherapy. Where does that fit in? When is
Yeah.
chemo used for gallbladder cancer?
Right. Chemotherapy has a few different roles. It can be given after surgery, that's called adjuvant treatment, to try to kill any microscopic cells left behind and reduce the risk of the cancer returning. Sometimes it's combined with radiation therapy. Then, for cancers that are more advanced, maybe they can't be removed surgically or they've already spread, chemo becomes a main treatment. The goal there is often to help people live longer. Or it's used as palliative therapy, meaning it's focused on shrinking tumors to relieve symptoms like pain, even if a cure isn't possible.
Okay. And what are some of the typical chemo drugs used and the side effects? What should listeners kind of be aware of?
Common drugs include gemcitabine, cisplatin, and 5-fluorouracil, often called 5-FU. Sometimes they're used in combination. As for side effects, they're pretty typical for chemo because these drugs target rapidly dividing cells. So, unfortunately, that can mean hair loss, mouth sores, feeling sick, vomiting, diarrhea, tiredness, and a higher risk of infections because your blood counts drop. The good news is the medical team has ways to manage or prevent many of these side effects. Some drugs, like cisplatin, can also cause specific issues like nerve damage, which might feel like tingling or numbness.
And moving beyond trying to cure the cancer, palliative care seems really important for many patients on this journey. What does that involve specifically for gallbladder cancer?
Yeah, palliative care is incredibly important, and it's not just for end of life, it's supportive care focused on managing symptoms and problems caused by the cancer or its treatment at any stage. It's really about maintaining the best possible quality of life. For gallbladder cancer specifically, a big issue can be a blocked bile duct. That causes jaundice, itching, discomfort. So palliative treatments might involve things like placing a small tube, a stent, or maybe a drainage catheter to help the bile flow again. Sometimes even bypass surgery is done to create a new path for the bile. These aren't aimed at curing the cancer itself, but they can make a huge difference in how the patient feels and help prevent complications.
Right, quality of life is key. And finally, let's talk nutrition. How vital is that for patients going through gallbladder cancer treatment, especially with potential side effects from chemo?
Oh, nutrition is absolutely vital. Maintaining weight and strength during cancer treatment is so critical for recovery, for tolerating treatment, and avoiding delays. But yeah, many patients struggle with nausea, vomiting, diarrhea, or just losing their appetite. For nausea, often bland foods served cool or at room temperature are easier to handle. Avoiding really fatty or spicy foods helps too, and it's really important to take any anti-nausea meds as prescribed and just sip clear liquids frequently to stay hydrated.
So things like small, frequent meals, it sounds like a common strategy for appetite issues.
Yes, exactly. That's a key strategy. Instead of trying to force down 3 big meals, eating maybe 6 to 8 small meals and snacks throughout the day can really help manage those appetite ups and downs. Focusing on high-calorie, high-protein snacks can be good things like granola bars, peanut butter on crackers, yogurt. If diarrhea is an issue, again, focusing on clear liquids is important to avoid dehydration. And foods with soluble fiber like white rice, applesauce, or oatmeal can sometimes help firm things up. And there are oral nutrition supplements available too for people really struggling to get enough calories in. It's all about giving the body the fuel it needs to fight the cancer and heal from the treatment.
Wow. We've certainly covered a lot of ground today on gallbladder cancer, from, the real challenges of that often accidental early detection through the complexities of surgery and that vital role of nutrition.
Yeah, if you sort of zoom out and look at the bigger picture, the journey for someone with gallbladder cancer is often really complex. It involves multiple types of care, multimodal care. And every single decision, from the initial staging to how much surgery is done to the supportive therapies like nutrition, every piece plays a critical role in their outlook.
That's a great way to put it. And the whole idea that something often hidden, found by chance, needs such a personalized, multifaceted approach, it really makes you think, doesn't it? About medical advancements, but also about the resilience of the body. So what does this all mean for you listening? Well, I think being informed even about less common cancers like this one, it offers valuable perspective on, the broader world of health, medical innovation, and what the journey of care can look like. As we wrap up this deep dive, just remember that knowledge really is power. And speaking of powerful solutions, I want to give a shout out to our sponsor, Stonefly. Again, they have an incredible offer right now. A 100 terabyte immutable and air-gapped SSO NAS for just $8,995. That's a huge amount of secure, cutting-edge storage. It really exemplifies the kind of innovation we appreciate. You can find more details at stonefly.com. Thank you so much for joining us on the deep dive. We really hope this exploration gave you some fresh perspective and a richer understanding. We'll be back soon with another stack of sources to unpack just for you.